I'm going to talk about topical pain relief. Um, but it's a good dovetail for fibromyalgia. My patient, and I'll put the link here for fibromyalgia, or at least the tutorial on fibromyalgia. Um, my fibromyalgia patients are typically the ones that need this the most. Athletes too, but the fibromyalgia patient or the chronic pain patient usually has a lot of pain in the upper shoulders. For whatever reason and for whatever time or duration of suffering, um, it is sometimes important to try medications or botanicals. Medications, unfortunately, with the fibromyalgia sufferer, or say the very young or very old, medications can cause side effects. So I try not to, after figuring out the patient's priorities, sensitivities, the biggest problems, I'll try to utilize medicine for a short duration of time to effectively change suffering. And also, again, with regards to fibromyalgia and pain, we want to control the pain and get that patient into mobility again, physical medicine again. The athlete, same thing. If the athlete is a runner, for example, and the runner is injured, we want the runner, as long as it's not a major injury, to try not to stop activity altogether and try to use as little prescription medicines as possible, but also try to truncate, regardless of whether we use prescription medicines or herbals, try to truncate and shorten the time frame of healing. An athlete is usually very good with regards to diet, so their healing time is usually compressed, so I can compress it faster with my suggestions depending on the patient. Fibromyalgia patients usually come to me with symptoms of irritable bowel syndrome, terrible absorption or tolerance to medicines, changes in food allergies, thyroid disease. So using a prescription medicine, I try to stay away. I'd rather do, unless they're suffering, I would rather do supplements first. Botanicals, I think there's great relief with a lot of oral supplements, but again, not to get off course, this here we'll talk about topical and what kind of side effects. Very little side effects with topical, but very powerful. I am a medical acupuncturist. I trained out of UCLA with Joseph Helms. One of the great things that we have with medical acupuncture is certainly needles, but this is technically topical, a topical tutorial. Needles help with decreasing pain and spasm. This is cupping. Usually when the skin is clean, we'll use a flame inside the cup to cause a vacuum and then stick the cup on the skin. And usually because there was a flame in there, the heat actually causes a change in pressure, and if you put it on fast enough, it'll cause, if there's a good seal, it'll cause a suction to an area of the back or the skin. In Western medicine, it doesn't really make sense. You cause a little suction problem or a hickey, I guess you can term it. How is that supposed to help anything, right? However, if you've ever had medical acupuncture or any form of acupuncture, cupping is fantastic when it comes to pain relief. And it has to do with meridia, has to do with these lines that exist on everybody. And sometimes when you have those energy lines blocked up, it presents as pain. So if you use cupping to help the body recognize there's a blockage there and get the blockage going, it relieves the pain. I just truncated the theory of 2,500 years of acupuncture into those few sentences, but that's it in a nutshell. So that helps. And it usually causes black and blue, but anybody that's been through it, they'll deal with the black and blue. This is moxa. Moxa is mugwort. Moxa stimulation or moxibustion. If you've ever been to acupuncture, usually what we'll do is we'll put the needles in, and then this is a moxa cigar, we'll heat it up, and it burns slow, but you'll heat it, you'll use the heat from the burning cigar and heat the needle. And it also stimulates that same concept of energy going on a channel or traveling on a channel in one direction, and injury or decreased energy flow results in injury. If you put a acupuncture needle before and after the injury and then heat in one direction with this moxa or moxibustion, it facilitates the movement of energy so you return back to normal. So technically this is topical. The one thing with moxibustion, especially mugwort, smells like, not that I know what marijuana smells like, but it smells like marijuana. So if you ever leave the doctor's office, like my office, and you're going to smell like marijuana and you're very happy because you just had acupuncture and your pain's down, you got to be careful when you get stopped by the police because they'll smell this on you, they'll see you smiling all the time, so they'll wonder. Anyway, I'll give you a note. So that's moxibustion. There's also topical TENS units that you can use with the physical. I don't have my TENS unit here, but it's essentially same concept. You put a sticky pad before and after, and I'll put my link over here to my talk on TENS units. Before and after the injury, and if it's an injury in Western medicine, you give a little electricity and it shocks the muscle and it actually changes the blood flow and it helps heal. However, in Chinese medicine, using that philosophy, it actually starts the movement of energy in one direction, whether you do pads or whether you do needles. So moving from there, there is a prescription anti-inflammatory that's topical. Again, I don't have that here because it's very expensive and I can't afford it. So it's called Pennsaid. Pennsaid is topical Voltaren. Voltaren is an anti-inflammatory pill. Somebody came up with making this pill into a topical solution form. So if you have an area of pain, whether it's the fibromyalgia pain up here or an area of an injury, like with tennis elbow, you drop 20 to 30 drops and you rub it in, as long as you don't have an allergy to any anti-inflammatories, and it penetrates the skin and gets anti-inflammatory into the area. Sometimes because it does get absorbed into the bloodstream, it can affect, if you have a history of ulcers, it can make your stomach a little upset, but not as much as taking a pill or Advil or ibuprofen. So it's a great alternative, but one warning is that it does cost a lot of money. So I will usually write a prescription for Pennsaid, and if the patient has a $10 copay, get it. If it's too expensive, forget it. I'd rather have the physical therapist apply steroids through the skin or just use modalities. So we'll move on to other things. Homeopathic. Tramil is great. Tramil is a homeopathic ointment. We usually will use this when doing, at UCLA, I was taught to do gua sha or skin scraping. It's essentially using a Chinese soup spoon, a very large one, and scraping the skin to cause that black and blue mark so that the body realizes that when the black and blue mark is being absorbed, it pays attention to that area. It's typically done on the upper back. But Tramil is an ointment. It has several homeopathic components in it. Homeopathy, the whole concept of homeopathy is, that's another tutorial, but by using the components of homeopathy in the ointment on the skin, it also helps with decreasing inflammation, decreasing, especially in the case of gua sha or skin scraping, decreasing the amount and time that the black and blue mark stays with you. I have patients that just rely on this. I think it's great as an accessory. I probably wouldn't use this solely this. I think it is very useful when you use it in combination with several different things and modalities. Tramil is great. You can buy this over the counter. Salonpas with capsaicin. This is very nice. This is the concept of capsaicin. With chronic pain, studies have been done on the use of capsaicin or pepper. Pepper extract or pepper derivative has been shown, obviously pepper like the tear gas pepper spray. It will sting your eyes, but in a toned down version, it'll actually, when you apply it, cause a heat. The heat has been shown to decrease something called substance P. When you decrease substance P out of one of the nerves that transmits the impulse of pain from here to the brain so that you recognize pain, decreasing substance P stops the impulse so that even if there is pain, the brain sometimes forgets that there's no that pain over here. So Salonpas, as long as it has capsaicin in it, it should say capsaicin, and I'll put the spelling of capsaicin. If it's just menthol, probably not as good. But capsaicin, in this you can usually find this in Walgreens. I'll open, well, this comes in a sticky pad. It's about this size. I usually will cut it into small pieces so it lasts a while. And then you clean off the back, take a shower, wipe off the oil, put the patch sticky pad up here, and it usually will release heat and pepper capsaicin slowly. So you'll feel a little bit of heat. If you put the whole pad on it, you're definitely going to feel heat. Now that's the one drawback with capsaicin. Although it decreases substance P, some people don't like pepper. And if you put too much of it on, you'll feel you're on fire. And that's where I picked this up at Walgreens. This is a squeeze bottle of capsaicin, pure capsaicin solution. The first time I put this on, it's rub on. I had to try to wipe it off, and it still wouldn't come off with soap. But this is very hot, so you use this sparingly. Maybe experiment with one dot to the skin, one area. Whoop! Now the table is going to be hot. Now my hands are going to be hot in a little bit, but experiment, see what you can tolerate. I'm assuming those from the south that love pepper will like the heat, but sometimes they feel like you're being sunburned. So that's capsaicin. Works great. You can use it 3 times a day. This is a generic version of a roll-on that has an evaporant. There are evaporants that when you spray and evaporates off your skin, it causes a cooling. That also distracts, and it's like getting a bag of ice on your skin. So icing, which is also a very good topical, icing can help deaden or decrease the impulse of that nerve firing from the spastic area to the brain saying, I'm in pain. Icing will stop the transmission of nerve impulse. And then usually, as long as it doesn't cause a frostbite, then after you get the ice bag off in about 10 to 15 minutes, there's a reflex vasodilatation, or blood flows into the area that makes the healing start up. So I think ice is very good. This is a cheap version of ice if you can't get ice and you just want the cooling effect. Menthol. This is pure menthol. Again, Salonpas has, some of them have menthol, but I think that the ones with capsaicin are the good Salonpas patches. So this is kind of like icy hot. Menthol evaporates and then it helps you forget about pain. Sometimes nice to block trigger points from getting any worse if you're starting to have a little bit of discomfort from using a phone for a little while. This is good for decreasing that pain sensation and working on stretching. And then comes my favorite and final, oils. Essential oils I think are great. I have there are several oil companies. Orcacia is one. You can find this anywhere, usually at Fruitful Yield or Whole Foods. A pretty decent company. They have their regular blends and they have their organic blends. You essentially take a plant and you distill a plant, get the oil out of the plant, and you put it into a bottle. If the distillation process is pure, and if they pick plants that are healthy, then great. You'll get exactly what the plant, the effects of the plant in you or on you that the properties are valuable for. If you have a company that's kind of not using the best harvest, might not be that great, and you might not feel anything. So be picky where you buy. If you have the money, I would go high end. Young Living is one of my favorites. This is called Panaway, and as most of you that go to my lectures will remember, I made it through my first marathon with this stuff. This is a high grade or pharmaceutical grade oil, and you can get the definition for that, but I was actually putting it on my knees because I had iliotibial band syndrome, putting it on my knees every couple of miles. By about the 20th mile, I ran out, so some folks saw me licking the bag because I just needed something. And I think it does help. There are some limited studies by the company, if you trust them, about its use with pain control, fracture improvement, fracture healing. So it is good. I also have an herbalist in Claremont, Florida, who introduced me to this concept of, she owns Jen Sense. She introduced me to the concept of using oils and aromatherapy. And actually, Jen is very good at blending oils specifically for the increasing or improving the healing process of the patient, but you actually have to visit her to get the special blended oil. If you want to just order, I'll put a link to her website. And she's very good with what she does, and I do believe she answers questions in case you have a question about the specific oil. This is just a roll-on topical, again from Young Living. Helps with if you don't want to get too smelly, because they do emit an odor or a fragrance, I should call it. So some people who are next to you or working in the office with you, if they have sensitive nostrils or are very hyper or allergic to things, they might smell that and start to become irritated with you. And whereas the rest of these, not much, well, except for this thing, not much smell. So hopefully that helps with regards to how to conservatively take down the sensation of pain and help with reversing muscle irritation.